Dysmenorrhea diagnosis and management. Menorrhea means menstruation cycle. Menarche means initiation of menstruation cycle, and dysmenorrhea indicates painful menstruation. It is a gynecological condition that significantly affects the quality of life of many women. It could be primary or secondary type. Dysmenorrhea affects a large population of women. Around 50 to 90% of the women are affected globally through this condition. It is very common in adolescents and young women. Work life is affected. If we could say, this research has given 51% women have been absent at least once in its work life. Risk factors include early menarche, heavy menstrual flow, family history of dysmenorrhea, or if smoking and physical inactivity is there, alcohol consumption is there, then this condition could be aggravated. So chances of smoking and alcoholism gives chances of dysmenorrhea to occur in a woman. This condition is of two types, primary dysmenorrhea and secondary dysmenorrhea. Primary is linked with the overproduction of uterine prostaglandins, which leads to increased uterine contraction or reduced blood flow that causes pain. So these hormonal changes are basically triggered by the menstrual cycle, and that leads to prostaglandin synthesis. Secondary dysmenorrhea is associated with secondary conditions like endometriosis, adenomyosis, pelvic inflammatory disease, or uterine fibroids. These conditions cause pelvic pain through inflammation or increased pressure. So these symptoms of dysmenorrhea impact the quality of life of a woman. If we talk about physical quality, then cramping, abdominal pain, back pain, nausea, vomiting and diarrhea, headache, these all cause lack of social engagement in a person, and the women gets into depression psychologically and gets into anxiety. And if we talk about economic impact, then absenteeism in the work life reduces the productivity of a woman. So it impacts physically, psychologically, as well as economically to a woman. What management strategies do we have? We have pharmacological and non-pharmacological approaches. If we talk about the pharmacological approaches, we have non-steroidal anti-inflammatory drugs, that is NSAIDs, and we have hormonal contraceptives, and we have progestins. NSAIDs basically inhibit the prostaglandin synthesis, like we have ibuprofen, naproxen, diclofenac. But the consumption of these drugs causes discomfort, ulceration. And we talk about hormonal contraceptives, these suppress the ovulation and thus reduces the menstrual flow. There is also risk of thromboembolic events in case of hormonal contraception. Progestins are basically for secondary dysmenorrhea due to endometriosis. Now, if we talk about non-pharmacological approaches, lifestyle modification like regular exercise and diet rich in fiber and low fat alleviates the symptoms of dysmenorrhea. Also, if acupuncture is there, alternative therapy, acupuncture, some studies suggest that these release endorphins that improve the blood flow. Herbal remedies like ginger and fennel. Fennel is very good in female hormones, so it will reduce the level of cramps in the women. Supplements like magnesium and B complex, omega-3 fatty acids are promising to have impact on dysmenorrhea. Some women go for heat therapy as well, like hot water bottles they keep it at their lower abdomen to reduce the pain. Whereas surgical treatments are there, laparoscopy and hysterectomy. Laparoscopy is for secondary dysmenorrhea due to endometriosis, and hysterectomy, if we talk about, then it is also in the case of secondary dysmenorrhea. We also have some ongoing emerging therapies, researches in this case. So not all the women are affected with dysmenorrhea.